why.
Right now, Denver's STAR program has the capacity to respond to less than half the calls coming in. The program pairs behavioral health clinicians and paramedics to help people in a mental health crisis and facing substance use issues. Our Anusha Roy is live outside of Denver's City and County building. And Anusha, a lot of people are wondering, because this is a successful program when it works properly, so how they're going to address this issue.
Yeah, if you look at the numbers, Jordan, it tells a pretty interesting story because so far this year, STAR has been flagged for about 13,000 calls, right? So that shows the demand that they're up against, but they've only been able to make it out to around 6,000. So we're talking about maybe 45% of the calls that are coming in. Here's the thing about that plan, right? So between this year's funding and then also with funding that is promised for next year, they have the ability to start working towards expanding to 16 teams, more vans. They'd also like to go 24/7 at some point. The problem, though, is that they're having trouble hiring for these spots. Not only is there the ongoing workforce shortage, but this team is also seeing a lot of turnover. It's a very intense job. There's also an issue with competitive pay. And even if they do expand to those new numbers I just talked about, they still wouldn't meet the full demand. And the team was talking about why that's such a problem.
I think our STAR teams are much better equipped to both de-escalate the situation in the moment, but also get people to the right resources that they might be needing. Oftentimes, these are complex cases. It's folks who have multiple, either behavioral health or substance misuse issues.
So in order to meet the full demand, the team would actually have to double in size. In 2024, they will be getting an additional $2.3 million in funding from the city. City Council was debating adding some more money on top of that. Jordan, that ended up not passing. One of the many concerns that was brought up was about reallocating money from other parts of the city budget.
And on top of all of this, Anusha, you and I have studied the numbers. Not only are they dealing with the shortage, this is also coming at a time where we're seeing an increase in the number of calls like this coming in.
Yeah, I mean, when I talked about 13,000 calls coming in, that was just through October of this year. So that's not even the total for the year yet. And there's definitely a demand. And one of the things one of the advisory committee members was saying that between figuring out the funding, the migrant crisis, homelessness, the number of people facing substance misuse, they know there are so many people that need their help, and they're just not totally confident that they'll be able to financially meet all of the needs and get to everyone they need to in the next year.
Yeah, which is why this is an issue that a lot of people should be paying attention to. All right, Anusha, we appreciate your reporting. Thank you.